Well, let me ask you this. You said that Kellyanne Conway criticized you. Where have you diverged from the administration?
Well, for example, the 30 days to when they extended the 30-day guidelines, my recommendations was that we didn't need to extend the 30 days because it was clear the reason we did the mitigation, remember, wasn't because we thought we could suppress the virus. We knew it was out. It was to slow the spread so that the hospitals wouldn't get overrun. It was my view that outside of New York City, our medical system was going to be able to handle what came down the pike. And sure enough, that happened in Florida. And so, my advice has not necessarily been taken. And then also in terms of when we went to phase one, they criticized us for doing phase one. But I can tell you, phase one in Florida, the 6 weeks after that were the lowest numbers that we had for coronavirus. If you look at COVID ED visits, if you look at positivity, hospital census. And so, that was really, I think, a good run for us. So they have criticized, but we're going to do what we got to do. And at the end of the day, the states have all gone in their own directions. There's not been any uniform way to do it, and certainly for them. And I give you an example. They had the White House task force said, you need to close daycares at the start of this. I didn't do that. I didn't see kids as being risk, fortunately, or low risk. And then I knew the essential workers, they had that. So we kept it open. Didn't have major problems with any of that. And then more recently, they were saying that we should close gymnasiums. The problem is that people who are staying in shape, that's one of the best things you can do to fight coronavirus. So we have diverged from recommendations. And basically, I'm just trying to do what I think is best for Florida.